Right, so welcome. We want to do a series of thinking over the next few weeks and months around sort of thinking about stress. Now, for all of us, when that presents to us as practitioners in our clinic, we often the client will just sit there and say, "Look, I'm feeling stressed," and we might measure that. We might say to them, on a 1 to 10, where is that, and how is that affecting you? And I think it's our job to start to think about how is that being reflected. Now, today I'm going to think more about sort of fascia and muscle and how people present in those ways. But before that, I want to just unpack it a bit more, so we get a bit of a feel about what people are presenting with. And stress can be, as we all know, lack of sleep. It can be a diet issue. It can be your concentration. It can be just feeling low, and let's use that word, feeling depressed. And for us, I think when people come in and talk about pain or discomfort or this word, then we have some responsibility to try and think about how can we help them. What avenues, what tools have we got in our toolbox to allow us to kind of start to help that person through this journey. And it may be that we refer, it may be a GP thing, it may be a medical thing, but I think it's also something about a lifestyle. And then the very fact that they're coming to see us gives us a good insight into them taking control of this and actually seeing it as something where we can help, and we can sort of start to create a place where people are driving rather than being driven. So how does that person, what toolbox have we got? Now, if you're a reflexologist, you'll be thinking differently. If you're a sports massage therapist, you'll be thinking range of movement and posture, which I'll get onto. If you're a holistic therapist, you might be thinking about energetic work, Reiki. You might be thinking about crystals. You might be thinking about chakras. All these things, I think, are really, really beneficial and really start to let people see what we do in our clinics. And our job is obviously about creating an environment where people can go away feeling more in control, particularly of this emotional state. But today I want to really just start to think about how does this fascia, this word that is bandied about, what is it a little? Maybe I'll get into that a little. But how is it presenting? What happens? And we will see these clients as they walk into our rooms, and they're closed in, they're rounded in their shoulders, maybe their breathing is shallow, they don't really want to open up, feel the fresh air. Have they got wind in their sails, or are they, I'm trying to keep out of the way, and how people present to us, and how the muscles, particularly, if you're talking about abdominal muscles here and the pecs, that rounding, shortening. And remember a couple of things here, that padding, that connective tissue between our muscles, between our organs, that fascia becomes dry, it becomes sticky, it becomes it should be juicy and easily moved around, and it becomes dehydrated and classically kind of short. Our muscle fibers are similar. They're, those filaments that move together, they get stuck, they get out of range, and we end up with this place where we're held in a position where we are emotionally kind of locked in. And I think it's a real important thing here that we must not separate people's emotional states from people's physical states. How we feel, be that stress headaches, be that sore tummy, you can get that kind of abdominal kind of digestive issues. It's really important that we link this together with our fascia and muscle, not just see it as a medical condition, and start looking at the person as a whole rather than as a separating things out. And I think it's really nice for us. We have the abilities on the inside to be able to sort of widen this out, and sure, bring in other aspects of the GP and other professionals to support people in this journey. But let's not forget about fascia and muscle and how people kind of hold their bodies in. That can be in the lower back very much. It can be because we sit a lot, and our hip flexors, our iliopsoas muscle that sits in our pelvis. It's our main big hip flexor. Interestingly, the top of the psoas is attached to a part of the diaphragm. So when we breathe and we become shallow in our breathing, often that reflects through and our psoas becomes tight because of our seating all day and our driving and what have you. There's a muscle that sits on our core behind, connected to our diaphragm, becomes an emotional kind of holder, I think. And often you find if people start to think about yoga, lengthening, there's a real emotional lengthening and release at the point where you start to get these muscles worked on. As you feel more open, as you allow your psoas and your hip flexors to feel more upright and more engaged, suddenly you're freeing some of these feelings. And that can be quite strong. I've had clients who I've worked with and you've done this kind of work and people have thought, wow, I suddenly feel quite emotional, quite tearful, and that's a really important step forward to driving this position rather than being driven. And it's an important thing to think about. In sports massage, it's all about posture, and that's obviously our key tool, checking what's tight and what's not. But let's leave it there for today, and let's just go away with some crunch kind of expressions in our heads that fascia and muscle are one. We must not separate this. This is the connective tissue that holds our whole body together, and I'm going to say both physically and also emotionally. The key aspect, I guess, is what we're trying to get to is when we've done our work and people are in a place where they're now open, then wow, suddenly you get people who can see and feel the sunlight rather than just avoid it. And I think that's probably a good place to leave it. And okay, thank you.